Most researchers, when they talk about the intestinal flora of the body, they say it is of primal importance, it's critical, it's vital to health, it's something that cannot, its influence on health cannot be denied. And when you take antibiotics, you're destroying this organ, really, and how it's viewed by many researchers these days, that all the 100 trillion bacteria that make up the intestinal tract versus the 10 trillion human cells in the body, the 100 trillion bacteria is very vital and important to health. So if we take antibiotics and we destroy this, as also chemotherapy will do, will destroy all the bacteria in the intestinal tract as well as healthy cells. But if we take antibiotics, we're destroying 100 trillion bacteria in the intestinal tract. Studies have been done that have shown that in one study with clindamycin, that as long as 9 months later, there was no bacteria in the intestinal tract after taking antibiotics. 9 months later, there were no beneficial organisms. The only thing that was present were the bacteria that were antibiotic resistant. So we've created this antibiotic resistance, and the only ones that survive are the bacteria that develop the resistance. A common misconception over the years has been that antibiotics kill all the weak strains and only the strong strains survive. But recent research shows that that's not the case. It's actually the strong strains many times which will sacrifice themselves because they're able to take the antibiotics, develop the mechanisms inside the cells of the bacteria to counter the antibiotics, and then they pass that information on to the weak strains. So recent research shows us that it's actually the weak strains that are surviving quite effectively with antibiotics. And so that's something else to take note of, because with science, something's always coming along to sort of update us on what we think we know. And even in the field of science, the assumption that it was the weak strains that were dying off was just an assumption based on what one might consider to be a rational explanation of what was happening, but in reality, the stronger strains were the ones that were developing the resistant mechanisms for the weaker strains to survive. So it's not just that the bacteria that are strong are the ones that stay. Another important thing to note when we take antibiotics, that sometimes, at least as far as we know from research, that the original makeup of the intestinal flora never regains its original state that existed prior to antibiotic use. And depending on which bacterial species you wipe out, that can have a strongly detrimental effect. Some studies show that Bacteroides, which is the most abundant anaerobic bacteria present in the intestinal tract, can be severely destroyed by certain antibiotics. Bacteroides play a role in producing short-chain fatty acids, and short-chain fatty acids play a protective role for the intestinal tract. They help prevent against leaky gut, chronic inflammation, colitis, Crohn's, irritable bowel disease, and cancer. So short-chain fatty acids can actually create the loss of short-chain fatty acids due to the loss of the Bacteroides species of bacteria, which is the most abundant species, can lead to cancers in the body. And again, that's not something that's going to happen right away. Although some of the more acute problems that do occur with antibiotics are going to be diarrhea and vomiting, occasionally life-threatening colitis. The inability to digest food is very common. You have antibiotics and all of a sudden you can't digest food. And this is one of the things when I'm talking with people as a way to gauge the health of their intestinal tract, I will ask them if they eat red meat. And if they do eat red meat, how long does it take them to digest that red meat? And what I mean by that, if you eat red meat, how long before you're hungry again? Because when people are doing the McCombs plan, we find that if they eat a steak and they have some potatoes and they have a bunch of vegetables, that within an hour they're hungry again. They want more. And that's the sign of a digestive tract which is very effective at digesting food and processing everything, all the nutrients. So it's important to understand that antibiotics are creating a very devastating effect, and with the loss of all these beneficial bacteria, we lose digestive function. And it's these bacteria which synthesize vitamin K for clotting. They synthesize B vitamins, which are necessary for use with everything in the body. B vitamins are essential in the ability to digest and absorb proteins, fats, and carbohydrates. That's everything. That's pretty much everything unless you're living on liquids. and just water, because if you have something which has carbohydrates like sugar or something like that, then that's carbohydrate. So B vitamins also play a very important role in helping to synthesize hydrochloric acid for the stomach. Without hydrochloric acid, we lose the absorption of protein or the amino acids. We lose the absorption of calcium, of iron, iodine for thyroid function, calcium for strong bones and for many reactions in the body. We lose magnesium with over 300 known functions in the body. If we start losing absorption of magnesium, that's very devastating. But you can see each one of these ingredients has a very widespread role in the body in terms of health and function. And if we start losing the ability to absorb these nutrients, B12, folic acid is known to protect against cancer. B12 deficiencies play a tremendous role in proper nervous system function. B12 and folic acid deficiencies also create different types of anemia, as well as does iron. But it's you're unlikely to see those deficiencies in a regular blood test, because it takes a long time for iron to show up as deficient in a blood test when we've lost the ability to absorb it. You'll probably see some other markers such as ferritin and tissue iron binding capacity, other things, maybe hemoglobin, maybe you'll see decrease in red blood cell production. So there are a lot of other factors that can show up on a blood test when we lose the absorption of these nutrients. But the bottom line is when we take antibiotics and we destroy the gut flora, we start having a lot of downstream, downline effects from the use of antibiotics.